Good morning, Facebook. I am Megan Rogers with Indiana Ship, and we have a wonderful Facebook Live for you today, What to Know Wednesday. And before we get into that, I want to introduce my lovely co-host, Susan Spilly in Indianapolis. Good morning, Susan.
Good morning, Megan.
Well, today we have a special guest with our coffee and conversation. We are going to have some coffee and conversation with Angela Lewis with 219 Health Network. Good morning, Angela.
Good morning, Megan. Good morning, Susan. Thank you for having me.
Oh, you're very welcome. So, Angela is one of my newest ship counselors in Northern Indiana, with one of my newer ship sites, 219 Health Network. And she is going to let us know what 219 Health Network does, where they're located, and all of that. So, Angela, can you start us off with letting us know a little bit about your title and what 219 does?
Yes. I am the outreach coordinator for 219 Health Network. So I get the honor of going out into the public and explaining to them who we are, what we do, and then also let them know that we are ship counselors. But we just go out there and tell them a little bit about us. And yeah, any outreach events that they have, whether it's a festival, carnival, fairs, whatever, I'm there. I'm trying to attend
Wonderful.
as many as I can.
Wonderful.
Mhm.
What does 219 Health Network do as a whole?
We are our location. We're a clinic that's based out of East Chicago, Indiana. But we do have providers and specialty providers located throughout Lake County, Indiana.
Mhm.
We have about 25 locations and 50 providers in total. And then we just have the highest quality of care at the most affordable cost for the communities that we serve.
Wonderful. Is 219 a federally qualified health center?
Yes, they are. If you wanted me to share a little bit about what a federally
Yes,
qualified center
please.
is, it's a federally funded nonprofit health center that provides primary care and support services to the medically underserved populations.
Wonderful.
Yeah.
Wonderful.
And do people, if they don't have insurance or maybe they're underinsured, do you have a sliding scale for your fees for your services?
We do. I'm sorry, I should have finished that. These centers, we offer, regardless of the patient's ability to pay, and operate on a sliding scale fee based on their income. So we aim to improve the access to healthcare for individuals in these areas, ensuring that everyone receives all of their necessary medical care.
And you serve people of all ages too, right?
We do.
From
Yeah.
prenatal to
All the way up to, yep.
all the way to the end.
Yes.
That's terrific. And that's why it's so terrific that 219 Health Centers has agreed to be a ship counseling site. So when people who are on Medicare, whether they're young or old,
Mhm.
Mhm.
can receive medical care and help understanding Medicare and all the options. So thank you
Yes.
uh, for doing that.
Thank you. Appreciate it.
And there's three of you at 219 that are ship counselors. Now, you and Daisy have been the ship counselors the longest, about a year now.
Yes.
And then Adelina just
Adelina.
got trained in March,
Hmm.
and you're all still in the mentoring, still
Right.
observing appointments for the most part. Now, Adelina and Daisy, they're navigators, correct?
Um, Daisy is,
Okay,
Adelina, I believe, is in her learning stages for that as well.
okay. Can
Yeah.
you explain for the audience a little bit about what a navigator is?
As far as I know,
Hmm.
the navigator for what Daisy does is that she's also able to assist with Medicaid.
Hmm.
So if someone comes in and they have several options, we can offer the patient, whether it's Medicaid, Medicare, or our sliding fee program. So they get quite a few people that come in daily.
Oh, I
with some
bet.
kind of,
Hmm.
yeah, with some kind of assistance that they need. So,
Wonderful.
yeah.
And I think the navigators can also help with the marketplace insurance plans as
Oh,
well.
okay.
Yep.
Yes.
So the whole
Mhm.
spectrum of insurance, which is
Yes.
wonderful. Yes.
Yes.
Um,
So
so,
they're very busy up front.
oh yeah, I bet.
Yes.
So again, I know you're in the mentoring, so you haven't done any hands-on ship counseling yourself, but in observing some of the appointments, what has been some of your favorite parts of the ship experience so far?
Well, all of it is extremely interesting to me. But I think the most that's like stood out to me to get my husband on board because he is a little older than I am and
Mhm.
he should be already. I found out that you get penalized
Oh,
if you're not on Medicare, but
mhm.
thankfully he is still working, but he still hasn't taken care of that part yet either. So,
Oh,
yeah, so he needs to have his s- um, company send something into Medicare to say that they are uh what do you call it? How you're
creditable.
yeah, credible. There you go. But yeah, I've
Okay.
been on him like, hello, you need to get this together. What are you doing?
Well, it sounds like we need to have him in for a mentoring appointment.
Yes. He's good to go. He's still there. He plans on staying till he's like 72, but
Oh,
you
well, he
know,
doesn't need
he's
to do anything until he retires then.
no, he's not retiring anytime soon.
Okay.
He's still loving the life. I don't know how, but he is.
Well, he's good then. He doesn't need to send anything in then until
Yeah,
then. So,
but I was just like, I did not know that. Oh my
mm-hmm.
goodness. Yeah, so
Yep.
you learn something new every time I get on a call. I'm like, wow,
Mm-hmm.
okay. Even
Mm-hmm.
like the financial situation and what their status has to be. Yeah, everything
Yep.
is just it's interesting to learn something on almost every call that I'm on. There's
Mm-hmm.
something new. So,
Mm-hmm.
And I will tell you, that both Megan and I and all of our coworkers, we also have kind of a job like yours, partially, where we do a lot of outreach. And I always say when we're out there in the community, we get two questions asked of us a lot. And the
mhm,
first one is, do I have to sign up for Medicare when I'm 65? And there's a lot of people like your husband who's actively working for a large employer and he has health coverage and credible drug coverage. And so those people don't have to apply for Medicare.
mhm.
The other question we get a lot, and you might prepare yourself for this one, is how do I make all that mail stop? And all those people calling
Oh,
me and texting me and emailing. And
yeah.
sad to say, other than blocking and not answering your phone, there's not a whole lot you can do about that.
Yes,
But
we do get a lot of that.
Mm-hmm. Mm-hmm.
absolutely.
Yeah.
Yeah.
Mhm. Awesome.
Well, Susan, can you think of any other questions for Angela?
Well, how do people find out where you're going to be? And do you have a website that you can share? And we'll put it in the chat. If people that live in East Chicago and Lake County, Indiana, might want to find out more about 211. How do
Absolutely.
they go
Thank you
about
for
doing that?
yeah,
219.
thank
219. Sorry.
yeah, that's okay. Thank you for asking that. That's a great question. Our activities, our events that we participate in are on our website and it's 219health.org. And there's a tab for events. So when you go pull the drop down box for events, you can see where we're going to be for the next couple months. We do also have a social media site on Facebook and Instagram. It's 219 Health Network, and all of that stuff is posted on there as well.
Terrific. So they can find where your clinics are located and call to see if they would like to get their health care from a 219 health clinic. Terrific.
Absolutely. They can look by provider, they can look by location, however they decide to do their search. If they just want to look for me and events, they can do that too. So whatever you're interested in looking for. Mhm.
Yeah.
Speaking of events, Angela, can you tell our audience a little bit about the event that you're having tomorrow and that they may see a familiar face
Oh, yes. So Megan will be attending one of our events that we are actually hosting
and your
here.
face too?
Yeah, yes, you'll get to see my face this time since the camera is not working. But we are having one of our quality team is putting together an event that is hosting like our BCCP program, our asthma program, and what's the other one? BCCP, asthma, and oh my goodness, how is it just flying past me? I'm so sorry.
You're fine. I put you on the spot.
Yes, the self-monitoring blood pressure. I'm so sorry.
Okay.
Yeah. So at this event, we're also going to have community resources that will be there. But for the BCCP, that's for the breast and cervical cancer
Hmm.
program, it offers free or low cost breast and cervical cancer screenings, diagnostic testing and treatment referrals to eligible women in the area. The Exhale is focused on asthma management and how to get them to either control it or, reduce emergency visits. The self-monitoring blood pressure program is an American Heart Association program that provides blood pressure monitors to the patient. So through our loaner program, we encourage and help our patients to take control of their care. So those are what we're going to have. Those programs are going to be offered, and we're also going to have, like I said, other resources there, which MD Wise, Care Source, American Heart, the Excel, United Healthcare, Geminis, and the United Healthcare is the Medicaid part.
Hmm.
City of East Chicago is going to be there with their health department.
Hmm.
SHIP is going to be there, so thank you for coming. And Hope Alliance of Northwest Indiana. We'll also added they're going to have face painter and balloon artists for the children. And we have a tent that's going to serve Mexican food.
Ooh.
Um, and what else am I missing? Oh, the Y will also be there. They were the
Oh,
last
good.
ones to join. So they're going to have their sliding fee thing that they have for their people too, where it's a discounted for those that qualify.
Wonderful. And
Well,
what
Yeah.
that
time is
sounds
it?
like a fun community party.
Yes.
Hmm.
Yes, it slowly went from our programs to expanding to let's add resources because these people need to, they need to have these
Hmm.
resources out there. So it's great. It's
Wonderful.
great that we're offering that. So yes,
Hmm.
that
And
is
where is that
tomorrow.
going to be?
That's tomorrow, June 12th from 1 to 3 p.m. at our 100 West Chicago Avenue location in East Chicago, Indiana. And we will also do it again on Thursday, July 26th from 1 to 3.
And those
Same
are
location.
central times.
Central. I'm so sorry.
Oh,
Yes.
no, you're fine. Hmm.
Yes.
Hmm.
Central time.
Wonderful. Wonderful.
And then we'll also have some of our providers that will be out. So tomorrow we'll have one of our nurse practitioners for pediatrics, Leilani Reyes, and one family practice nurse practitioner, Christina Quiros, will be there tomorrow. Yep. So
Wonderful.
yeah, it's a mouthful. We had I had to try to get all of that in there. Like, yes, all of that will be there tomorrow. It's going to be a busy day.
Sounds like it.
Yeah.
Well, folks, if you are going to be in the East Chicago area and want to find out some terrific information about area resources and 219 and SHIP, check it out. You don't need a reservation. You can just go and join the party, eat some food, get your face painted.
Absolutely.
Wonderful. Well, Angela, can you think of anything else our viewers should know about 219 Health Network?
I think we pretty much put it all out there. I don't think there's anything else. Yeah.
Wonderful.
And
Well,
and
thank
if they
you.
have, yeah, any questions or they'd like to even apply for the sliding fee program or whatever online, that is also available on the website at 219health.org.
Wonderful,
Yeah.
wonderful. Well, I'll make sure I get that put in the chat box. Thank you for coming on and sharing all that wonderful info. I'm excited to see you tomorrow. And
Mhm.
Susan, can you share with the audience what we have coming up?
Yes. we're going to have a little graphic about that.
Ooh.
All right. So we have two more Facebook Live programs for June. Next Monday, we are going to do something that is going to be fun. You might
Ooh.
learn a little something, but the emphasis is on fun
Yes.
and winning prizes. So we're going to play bingo over the internet. So that's tomorrow. That's Monday at 10 a.m. right here on our Facebook page. And if you visit our Facebook page, which you're on it now, you'll find instructions on how to get your bingo card. Megan basically is going to email you one,
Mhm.
and then you can play along at home. And when you win, we will mail you a prize. So join us. It's going to be fun and educational. Then on the 30th, the following Monday, Jennifer Groth, who is one of our staff people at the Indiana Department of Insurance, and she's going to talk to us about all of the consumer services that we can get as Hoosiers from the Indiana Department of Insurance. And Jennifer's been there for a long time, and she knows about all the divisions in that department. And that's where SHIP is housed in Indiana. So we all work together, but it does a lot of things. And you can get a lot of services for your tax dollars from the Department of Insurance. So try to join us and find out what those might be.
Awesome.
Thank you, Susan. Well, thank you all for tuning in. Thank you, Angela, for joining us. Everyone, have a wonderful rest of your week, and we will see you back here live for Medicare Bingo next Monday. Bye, everyone.